what's scared me is the person I know who hasn't made it of COVID-19 from COVID-19 was actually diabetic, a badly controlled diabetic. And people think I keep harping on about diabetes. It's because diabetes is a long-standing disease, and it prevents any repair from happening in a person's body, and there is consistent damage to all small blood vessels in the brain, in the eye, in the heart. And this particular person died because of the diabetes-induced and helped by COVID problems in the heart. It wasn't the lung.
Right.
So, so you've got to be very careful of contracting it, and make sure your defenses are up. Anybody who has diabetes, please make sure that your HbA1c, which is the 3-month sugar level, are under control. And this is a time where everybody is doing the same thing, nothing.
Yeah.
So utilize that time, try and exercise, try and, as they say, obesity doesn't run in families. Obesity happens because nobody runs in the family. So I know it's very difficult, if you haven't got access to a big garden or something, but, yoga doesn't take a lot of space. You just need a mat and 6x6 space, which I'm sure most people have. Exercise is a fantastic way to raise immunity. Okay. It's not just for weight loss. It's not just for muscle size. Those are just what I call side effects of what happens when you exercise.
Okay.
It's a great way. The best way, naturally, you've got a million Ayurvedic ways of increasing immunity. Have this, have that, have turmeric, have haldi doodh. That's fine. I mean, we've always been taught that by our parents and grandparents, and I completely agree with that. But if you can top that up with exercise, you've got a great thing going for your immunity.
Yes, that's so good to know. Are smokers at a higher risk? Because
yes. Well, it's hilarious. Smokers are at a higher risk because they've got lesser immunity than non-smokers do. That's a fact. There is a French paper apparently doing the round saying that smokers are less at risk. I wouldn't necessarily agree with that. So as I said to someone, so you won't get COVID, but if you continue smoking, then you will definitely get lung cancer.
Yes.
So, I mean, COVID is definitely the lesser of the two evils.
Yes.
So.